Assalamualaikum warahmatullahi wabarakatuh. We are from group number 15. In this video, we would like to present our work. The topic is understanding diabetes from awareness to effective management. Next, the table of content is, you can see it. Now, the first is introducing diabetes. Hi, my name is Novian Tribayudi, and I will give introduction about what is diabetes. Diabetes is a group of metabolic diseases characterized by hyperglycemia resulting from defect in insulin secretion, insulin action, or both. Diabetes is distinguished by disturbances in carbohydrate, fat, and protein metabolism. The clinical symptoms include polyuria, polydipsia, polyphagia, weight loss, tiredness, and blurring of vision. With severe metabolic dysregulation, ketoacidosis or hyperosmolar non-ketotic coma may occur. Diabetes is associated with the development of long-term complications that can be divided into two main types. First, microvascular complications include retinopathy, nephropathy, peripheral neuropathy, and autonomic neuropathy. Second, macrovascular complications include cardiovascular diseases with increased incidence of atherosclerotic cardiovascular, peripheral arterial, and cerebrovascular diseases, as well as heart failure. Hypertension and dyslipidemia often coexist in people with diabetes. So that is the introduction of diabetes. Next, Hasan.
Okay, let me introduce myself. My name is Muhammad Wildi Lutfi Hasan Mulyadi. You can call me Hasan. In this slide, there are three main types of diabetes: type 1, type 2, and gestational diabetes. Type 1 is an autoimmune condition where the body attacks insulin-producing cells, leading to little or no insulin. It often appears in childhood and requires insulin therapy. Type 2 diabetes is the most common type, caused by insulin resistance or insufficient insulin production. It's linked to lifestyle factors like obesity and inactivity and is managed through lifestyle changes, medication, or insulin. And the next type is gestational diabetes. Occurs during pregnancy due to hormonal change causing insulin resistance. While it resolves after childbirth, it increases the risk of type 2 diabetes for both mother and child. Understanding these types is vital for effective management and prevention. Next.
Cause and risk factor. The cause of diabetes, first one is type 1 diabetes. The causes occurs when the body's immune system mistakenly attacks and destroys the insulin producing cell in the pancreas. This is result in little or no insulin production. The exact cause of this autoimmune reaction is not fully understood, but it may involve genetic factor and certain viral infection. For the type 2 diabetes, type is more common and type typically develops over time. It happens when the body becomes resistant to insulin or doesn't produce enough of it. Key contributor of this condition include obesity, especially excess fat around the abdomen and lack of physical activity. Genetics also play significant role. Having a family history of diabetes increase your likelihood of developing this type. For the gestational diabetes, occurs during pregnancy when hormonal change made it difficult for the body to use insulin effectively. This type usually resolve after childbirth but can increase the risk of developing type 2 diabetes later in life. For the risk factor of diabetes, first one is non-controllable factor. Age is significant risk factor, with individuals over 40 being more susceptible. A family history of diabetes also increase risk. Then controllable factor, lifestyle choice play crucial role. Being overweight, particularly with excess abdominal fat, significantly rise the risk for type 2 diabetes. Additionally, physical inactivity contributes to weight gain and insulin resistance. For dietary habits such as consuming high amount of sugar and unhealthy fats can lead to obesity. Smoking is another smoking is another risk factor linked to an increased chance of developing type 2 diabetes. Next.
Okay, hi everyone, I am Faisal and here I'm gonna explain about symptoms and diagnosis of diabetes. So what is the common symptoms of diabetes? The first, increased thirst. Thirst is a strong wish, in this context, desire of drinking a lot. And the second one is frequent urination. And then the third, extreme fatigue. Fatigue is in extreme tiredness condition of our body. And then the fourth, unexplained weight loss or gain. And this condition is more common in type 1 diabetes. And also, there are some additional symptoms like blurred visions, glaucoma, slow healing, cuts or sores, itching, or skin issues. And now, so how do we know whether we are suffering from diabetes or not? So the first step, we can do blood glucose test. So your blood glucose will get checked. And the second one is oral glucose tolerance test, OGTT, which how our body responds to a dose of glucose. And the last one is HbA1c test, which measures the amount of glucose attached to hemoglobin in our blood cells. And the next topic will be explained by Alex. Thank you.
Okay, thank you, Faisal. Let me continue. Okay, first of all, my name is Abaswan Adrian Talagawa, but you can call me Alec. So I'm gonna explain about the complication of diabetes. Diabetes can lead to various complication categories into microvascular and microvascular issues. The first one is microvascular complication. A, neuropathy. Diabetic neuropathy affect nerve fibers throughout the body, leading to the pain, tingling, loss of sensation, particularly in the feet and hands. B, retinopathy. This condition affects the retina and can lead to vision loss. In diabetes, the earliest sign of often a formation of microaneurysm, which can progress to more severe form like proliferative retinopathy. C. Nephropathy refers to kidney damage resulting from prolonged high blood sugar level. It can lead to albuminuria, the presence of albumin in urine. The second type of complication is microvascular complication. A. CAD, or coronary artery disease. Diabetes significantly increase the risk of CAD, leading to conditions such as heart attack. B. Cerebrovascular disease. Diabetics have higher incidence of stroke to atherosclerosis, the buildup of plaques in blood vessels, which is exacerbated by the factors such as hypertension and dyslipidemia, commonly seen in diabetic patients. C. Peripheral artery disease, or PAD. This condition affects blood flow in the limb, leading to symptoms like pain in the leg during exertion and even amputation. The other complication includes skin infection, dental issues, and digestive problems. Effective management is crucial to prevent these serious health risks. Okay, next slide.
Let me introduce myself. My name is Farhan Rafif Pasha Hendrajaya. Here I will explain how to prevent diabetes correctly. Here are some ways to prevent diabetes at a young age that you can do start now. The first is regular exercise. How to prevent diabetes through regular exercise can increase insulin production and the sensitivity of body cell to insulin. That way, blood sugar level will be controlled so you can avoid diabetes. The second is maintain ideal body weight. Obesity is one of the main cause of diabetes. This is because obesity interferes with metabolism so that body cells are unable to respond to insulin optimally. Therefore, maintaining an ideal body weight is one way to prevent diabetes naturally. The third is implement a healthy diet. How to prevent diabetes early on must also be accompanied by the implementation of a healthy diet. Try to reduce fast food, high sugar, and fatty foods. Start choosing food with high nutritional content such as protein, fiber, and vitamins. And the fourth is check your sugar blood regularly. Regular blood sugar checks are needed to see the blood sugar level in the body. By doing regular checks, you can monitor your blood sugar level and detect diabetes early. Next will be explained by my friend.
Hello everyone, my name is Lucky Fernando. Here I will explain treatment and management. Number one, lifestyle change. Lifestyle change to treat diabetes patients are advised to consume food for diabetes and increase low-calorie foods, as well as food rich in fiber and low in sugar, such as food as vegetables, fruits, and grains. Number two, routine checkups. In addition to change diet, patient can also undergo independent blood sugar tests 4 times a day, or as recommended by the doctor. This test is done before eating and sleeping to be recorded and broke when check-in with the doctor. Number three, medication. Medication treatment for type 2 diabetes can involve various types of medication that are tailored to the patient condition. One of the most commonly prescribed medication is metformin, which can help reduce glucose production from the liver and increase the effectiveness of insulin in the body. Number four, insulin therapy. Insulin therapy is used to help regulate blood sugar level, especially in patients with type 1 diabetes. Insulin will be given by injection. Okay, thank you for attention.
Here is the reference of our work. Next slide. Thank you for watching our video about the understanding diabetes from awareness to management. Thank you.